Good morning to respected panelists, the organizing committee, and my fellow colleagues. Today I'll be presenting the study titled Prevalence of Accessory Canal in Anterior Maxilla in a Subset of Indian Population, a CBCT Study. The study was done in India. Following are my contents. We'll be looking into few keywords: anterior maxilla, accessory canal, CBCT, nasopalatine canal, and canalis sinuses. A brief background of my study. We'll be looking into the anterior maxilla, which is a common site for surgical interventions like orthodontic surgery, periapical surgeries, implants, or surgical removal of impacted tooth. So, knowing the nerve supply of the anterior region is important. So, we know two major nerve supply that supplies the anterior region, which is the anterior superior alveolar nerve, which traverses through the canalis sinuses, and the nasopalatine nerve, which traverses through the nasopalatine canal. However, we often overlook the accessory canals that branches of these major canals. So in my study, we'll be focusing on the accessory canals. So this is a radiographic representation where we can see a canalis sinuses and an accessory canal branching downward. They can be called also known as lateral incisive canal or neurovascular variations. And so why is it important to know these canals? Because it can lead to diagnostic confusions, which can lead to a wrong treatment, which can lead to paresthesia or pain. So CBCT plays an important role and will help us in three-dimensional evaluation of this accessory canal. So coming to problem statement, there have been limited studies across the world that have evaluated the prevalence of these canals, and a wide variation has been found. That is from 16% to 70.8%. A study in western part of India was done and a prevalence of 27.5% was reported. However, we know India is a country which has diverse ethnicity and geographical variation. So the present study was designed to assess the prevalence of these canals in South Indian population. So following are my objectives: to determine the prevalence of these canals in a subset of South Indian population, to assess if any association exists between the occurrence of these canals with regards to age and gender, to assess the location, size and course of these canals, to evaluate the connectivity with the major canals. A brief look into the review of literature in a tabulated form. So we can see a few scattered studies across the globe has been done in Turkey, China, Brazil, Switzerland, Belgium and Germany. And as we know, a wide variance of prevalence has been found. And interestingly, the frequent location of this canal in relation to the tooth region was also seen to differ. For example, in Turkey, it was found only in the maxillary intercentral region, while in China and in Brazil, it was found to be in between central and lateral incisor, while in another study in Brazil, Switzerland and Germany, it was found to be central incisors, while in Belgium, it was found to be canine. The lone study that was done in India, they found the frequent location to be in incisors. However, they did not specify the central or lateral incisor. So from this we can infer that there may be ethnical variation in the prevalence of these accessory canals. Coming to methodology, the study was a retrospective observational study and the scans were taken with Kodak CBCT machine with standard parameters. My study sample consisted of 310 subjects with 167 males and 143 female in an age range of 15 to 85 years. The inclusion criteria was CBCT of good quality and sufficient imaging area with no pathological disorders. The image analysis was done using CareStrip 3D dental imaging software, and the image were analyzed in axial, coronal and sagittal sections. The location of the accessory canal was done using FDI notation. So here we can see axial sections where we can assess the location of this canal. Here we can see it is present palatal to the canine region, that is a 2-3 region, and the diameter as measured is 1.4 mm. Diameter of more than 1 mm was considered because larger diameters are seen to cause more potential complications rather than smaller diameters of less than 1 mm. In the course of the canal, that is palatal or labial, was seen in the sagittal sections, where you can see that this canal is showing a palatal course. And the connection connectivity of the accessory canal to the main canal, that is the canalis sinuses or the nasopalatine canal, was assessed either in coronal or sagittal sections. Coming to statistical analysis, it was done using SPSS software, and those were my following statistical tests used for each objective. Coming to the results, the prevalence was found to be 34.5% in our study. So when we see the distribution of subjects based on age and gender, the canal was most prevalent in the age group of 41 to 60 years and the least prevalent in less than 20 years. And the prevalence was also seen to be a little higher in male compared to female. However, this difference was not significant in terms of age and gender. In terms of distribution in different locations of the maxilla, it was seen that it was the highest in the canine region, specifically 2-3 region. The diameter ranged from 1 to 1.6 mm, and there was no significant difference among different age group and gender. In terms of distribution of the number of accessory canal, based on their course, it showed 85% showed palatal course, which was the highest, and the maximum of the canal showed connectivity with canalis sinuses. There was good inter and intra-observer variability in the present study. Coming to discussion, so we can see there is a wide range of prevalence from the present study compared to the other studies that was done, including the Indian study, because it was a little higher than the study. So definitely there is a population variation that is seen in the occurrence of these canals. Although no significant difference was observed in the occurrence of this canal between gender and different age group, the same was not seen in a Turkish pediatric population in terms of gender, that is boys and girls, and in Germany a difference was seen between the adolescent age group and an adult age group. The diameter was relatively the same with the Indian study and the rest of the study in the world. However, in Brazil they also reported a diameter as high as 2.58 mm. Coming to the difference in average diameter among different gender and age group, it was same in most of the studies found worldwide. However, in China, they reported a significantly higher average diameter in males compared to females. As discussed previously, the location of the canal in relation to tooth region varied all across the globe. The present study was similar to the Belgium study, where they found the most prevalent to be canine region. However, this was not the same in other countries like Brazil, Germany, Switzerland, China, and Turkey. Most of the studies, along with our present study, they showed they had the maximum, most of the accessory canal had palatal course and also had the most connection with canalis sinuses rather than nasopalatine canal. So, considering this wide variation in the prevalence of accessory canal and their location in relation to tooth region and even the size of the canal in terms of gender and age group, further studies are encouraged, especially in Asian population, to evaluate the role of ethnicity in the occurrence of accessory canal in anterior maxilla. Coming to the conclusion, accessory canals are prevalent but often overlooked anatomical variation in the anterior maxilla. Caution is warranted while performing surgeries in the canine region, particularly on the palatal aspect. Meticulous evaluation of accessory canal in maxillary anterior region via advanced imaging like CBCT prior to the surgical procedure is recommended. Adequate knowledge on such canal is important to relay findings to the surgeons. And further studies, especially among Asian population, is encouraged to obtain a better picture with the prevalence of the accessory canal of the anterior maxilla. These are my references. Thank you for giving me this opportunity to present my study, and I wish you all a very good day ahead.